Good morning, doctors. I hope you're all doing good. Good morning, everyone. Can you put it in the chat box? I want everyone to be very interactive because we are going to plan how your days are going to be. So that is the ultimate aim of this orientation session. So once again, good morning, doctors. And I use that deliberately. Let me absolutely be clear. In the next 60 days, the world will stop calling you a student and you will be started calling us a doctor. The transition doesn't happen on graduation day, which is going to be held in March or April. It doesn't happen because the university is going to give you the certificate. It happens right now. It happens in the decision you're going to make now. It happens in how you are going to handle the next 2 months of your upcoming days. And we are starting today. So let's forget about the past. Let's forget about the days you missed in the earlier. And let's even forget the days which you missed in the beginning of our session, beginning of our mentorship session. Last week we began on December 15th, but I know that many of you were not able to follow that timetable, follow because of your various works. And in between only we got our timetable for university exam, and thank God it is like in March. So you have approximately 60 days more to give your best in your exam. Your exam is tentatively scheduled around March, I guess, in the March first week. That gives us roughly 60 days. I know what you are all thinking right now. I can see what is written in your face. I can see the tension that is present in your shoulder. I can see the panic that you are set in. You are thinking that, sir, medicine is very big, sir. It's like a ocean. Surgery, Bailey is very, very tough, sir. It is impossible to complete that in this 60 days. Pediatrics has too many conditions to see, too many topics to read. What to read, sir? I don't know. And we are that unlucky batch which is having ENT and Ophthalm in the final year, which is added in top of everything else. Some of you are thinking you are drowning into the ocean before you are even started. So let me stop you right here. You are not the unlucky batch. You are not disadvantaged. In fact, you are chosen. You are being tested. This batch, your batch, is going to be the sharpest batch than any other before. Do you know why? Because you are going to learn the secret that most of the students never figure out. The only thing that kills medical students in final year is not the volume of syllabus. It is not the number of subjects that you guys have. It is not the thickness of the textbook that you are going to read or that is going to be present on your shelf. It is a lack of strategy. If you are not going to learn that strategy, if you are going to read everything, you will remember nothing. If you try to be perfect, you are going to definitely fail because you have only 60 days. And if you try to cover each and every topic in your Bailey and Love, in your Davidson, in your Datta, in your Shaw's textbook, in your Nelson, you are going to abruptly fail because now you have a limited time. In this limited time, you wanted to become topper. It's very easy for the existing toppers to retain their place, but it's very difficult for a person who is starting now to become topper, isn't it? For them, this strategy is going to work. If you try to cover all the topic equally, you will get burnout by January and you will still feel like you are unprepared. Today, I'm not going to give you just a timetable. You know what a timetable is. It is just a piece of paper that you are making every month, and it is going to lie in your wall, sticked in your wall, and you ignore after 3 days. It is, let it be a beautifully colored spreadsheet that makes you feel good for 1 week and becomes decoration. We have all done it. We have all printed numerous timetables, pinned them up, felt motivated for exactly 72 hours, and then life happens. You all feel demotivated. On the day one, you try to follow that schedule, you fail. Day two, you fail. You just pile up everything. And then on day three, you tend to become overburdened and you feel that you are giving up whatever you have decided 72 hours prior. Instead, today I'm going to give you something different. I'm going to give you a protocol, a military grade strategy to dissect, to consume, and to reproduce the entire syllabus in 60 days. This is not academic advice. The entire group idea is not an academic advice, but it is to frame a strategy which we followed, which we want our juniors to follow so that they are going to achieve success. I am not a faculty. I am not a one who is going to give you piece of advice, but I am going to be a same person who have traveled in the same path just 4 to 5 years before. And you have various other mentors in the group who have also traveled in the same path, and they want to give you the benefit of advice, the benefit of guidance that many are lacking today, because you guys have various resources, you guys have all the top notch app with you, you have all the top notch notes with you, but still you're failing. Still you have that fear. Why? Because you lack the strategy, you lack the mentorship, and that's exactly the role of Medusane here. Open your books right now. Look into your syllabus. Open Harrison, open Bailey, open all your clinical textbooks which you have. Look at the sheer magnitude of what is in front of you. It's absolutely terrifying, isn't it? The syllabus is infinite. The topics are endless. The rare condition, edge cases, historical notes, eponyms, and some things which we are not even going to use in your daily practice, but of course you have to read for your exams. And the natural instinct of all the humans is to try it and master it everything. But here is a secret that many of you doesn't tell you. You have 19 subjects, you have 60 days, you have infinite syllabus. So 19 subjects, why do I claim it? Because your final year is not just your subjects like medicine, surgery, pediatrics. It is going to be your knowledge from your previous years, to knowledge from your pathology, microbiology, pharmacology. Everything put together, a cocktail is what you are going to read in your final year. So that's why I never differentiate. You're going to get yourself prepared for the 19 subjects in your final year. And the problem here is a lack of strategy. That's what we are going to see today. You know what? Examiners are very lazy. The examiners are very practical. The examiner doesn't want you to know the genetic coding of a rarest tumor that appears in 0.0001% of the population. The examiner doesn't care if you are not able to remember 47 causes of hepatomegaly. The examiner wants to know only one thing. Next year, you're going to enter into internship and you're going to walk into the emergency department with chest pain. Will this doctor kill the patient or save the patient? If a woman comes to you with bleeding after delivery, what will you do? And if the newborn is not breathing, will this doctor will be able to resuscitate them? This brings us to the most powerful principle in productivity and life, that is the Pareto's principle, which is known as 80-20 rule. What is this 80-20 rule? Think about that. Let me say again, because this is going to change your life. The Pareto's rule states that roughly 80% of your mark comes from 20% of the topic, just 20% of the topic. 80% of your examination mark comes from 20% of your syllabus. What does that 20% look like? What are the topics that is going to guarantee you to get marks? The answer is topics that appear in every single exam, in every single hospital, in every single department, every single OPD. Myocardial infarction. How many times you are going to see this myocardial infarction in your lifetime as a general physician, or be it a general practitioner or any practice you are going to do? Hundreds, thousands, but the management is fixed. You know the door to balloon time. You know the drugs. You know what kills the patient and what saves the patient, isn't it? Shock. The patient comes to you with hypotension. Their skin is cold and clammy. What do? This is asked in every exam. This is asked in your general surgery. This is the foundation of your medicine. And then postpartum hemorrhage in obstetrics and gynecology. The woman is bleeding. You have just 5 minutes. Either you know the subject, you're going to stop the bleeding, or you're going to let your patient die. This is always asked. This is what they test you. Neonatal resuscitation. The baby comes to you, but the baby is not breathing. What do you do in the first 30 seconds? Every examiner wants to know this. If you know these four topics, I mean, really, if you know them and not just vaguely understanding them, you will pass with distinction, not just pass. You will walk into the exam all confident because you know what is needed to be covered in your final year exam, rather than covering A to Z of your Davidson and your Bailey. Conversely, if you know 100% of the syllabus, but only at the surface level, vaguely, passively, without knowing in depth, you will fail. You will get stuck in a question asking you to manage a complex case, but you won't know the answer because you never went deep. Our goal in the next 60 days is ruthless preparation, ruthless prioritization. We are going to ignore the noise, focus only on the signal. We are going to just identify the 20% that really matters, and we are going to master it completely. Let me address the elephant in the room. Let me address the elephant in the room. People tell you you are unlucky. People tell you you are unlucky because you have ENT and ophthalmology added to your syllabus. Previous batch didn't have. You are at disadvantage. But I am telling you the exact opposite. In subjects like medicine, you write 10 pages on stroke, pathophysiology, different types of stroke management, algorithm, complication, and the examiner will still find a fault. But sir, you didn't mention this particular classification. You missed this nuance of this particular management protocol. It is completely unsatisfactory. Okay. But in ophthalmology, in ENT, they are going to ask you the exact question like, write the management of cataract surgery. The steps are fixed. The order is immutable. Anesthesia, incision, zonular support assessment, and so on. You might write them in the order, you get full mark. You are not, there is nothing objective in it. There is no hidden gocha in it. Similarly, in your ENT, otitis media classification, it's fixed. Sudden sensory neural hearing loss, fixed. Management, fixed. These are the scoring subjects. Shorter subjects are scoring subject, and we have integrated them into the schedule with surgical precision. You won't be reading ENT and ophthalm for days and weeks and gets bogged down. Instead, we will strike these subjects with a laser focus for 2 days each. 2 focus days, you are done. And that's all what you need. This is not burden. This is going to be your advantage. So this is going to be your advantage. Clear, right? Any doubt? Clear, right? Yes. Now moving on towards the weapon that is going to be your RRR protocol. So let's look into the workbook which I have shared. I think you guys are already shared with it. If you are not shared, again, I will share you at the end of the session. So we have created a wonderful workbook. So last week it was actually starting, but don't worry, we are going to extend it into December 22. So that is your tomorrow. So we will start from tomorrow if you haven't started yet. Okay, but we are not going to start with medicine. We are going to start with surgery because I don't want you to start with medicine if you are not yet started yet. So at the end, we will go with medicine. So December 22, you are going to start, and then this will extend till January 16th. January 16th. So December 22 to January 16th is going to be your first revision. That is going to be your phase 1 of your revision. So what exactly we are going to do? So I'll tell you what exactly you're going to do. Okay, now let's talk about your weapon. The thing is that you're going to make a difference from chaos to order in the next 60 days. Everyone, if you open that final complete workbook, which I have sent already, those who I already have, so you can see it. So I have started with December 15th. Now you're going to start with December 22 if you're going to freshly start. So I'll give you 3 options. Okay, either you can start with your medicine itself from now, December 22, or if you have already started surgery, you can start with surgery. Okay, either medicine or surgery, you can decide with your among yourself. So if you see in this, I haven't given a vague one, isn't it? Did I give a vague instruction like read Harrison, cardiology chapter, study medicine from page 100 to page 200, learn everything about cardiology? I didn't give you like that. Instead, I have given you a specific targetable actions like heart failure, myocardial infarction, rheumatic fever, infective endocarditis, hypertension, asthma, COPD, pneumonia, TB. I have given you the exact question that is required for your exam. Notice the structure. Every single day, if you have been in the group already, you would have known that I am sending you question wise, topic wise every day. Every single day is broken down into specific topics that you will be covering during that day. So the one which I am sending you, please take it as a Bible. This is your GPS. Your job is very simple but powerful. I am doing at absolute free of cost. That means that what I expect you is you need to follow that. If you are comfortable with your own timetable, your own methodology, you're free to do that. This group is for people who stand without guidance, who stand without strategy, who stand without knowing what to do next. And that is my ultimate aim. So you have some boxes here. So this is your main timetable. After your main timetable, I am also sending you day-wise timetable, isn't it? So in this day-wise timetable, I want you guys to tick it down. I want you guys to tick all these boxes once you completed. Print out. So take a printout and keep with you. Tick once you complete those topics. Once you complete those topics, tick it. Every time you finish a topic, truly finish it, not just skim it, tick the box. You check it off, it becomes green. Now, I know what you might be thinking, sir, it is just a tick box. What does it matter? Why should I tick every day? But here is the thing, this checkbox is not just going to be a ink. The checkbox is going to be a small dopamine hit. It is your brain's reward system telling you, you are winning, you are progressing, you are moving forward. When you go to the sleep at night, I don't want you to lie in the bed anxious about thinking about neurology, nephrology, endocrinology, psychiatry, ortho, and all the subject you haven't touched yet. I want you to look into this printout and say, cardiology is done. I have ticked every single box under cardiology, and that's finished. That's the closure. That closure is vital. That sense of completion is not just psychological, it is neurological, my dear, and your brain needs closure. Your brain needs progress feeling. And when you feel the progress, your anxiety is going to drop and confidence is going to rise and you sleep better. Now, if you're going to see in this workbook, so what exactly we are going to do? This is going to become a structured discipline program. That's why I called it military strategy, a military protocol. No waking up and asking, sir, what I have to read today. I have given you what you have to read on everyday basis as a timetable. You follow the timetable, simply follow it. Nothing more, nothing less. Don't start, keep your mindset. I have to read page 1 to page 100 today. Don't have the mindset, I wanted to read all the things that is there in the textbook. What I want you to do is read specific question, specific topic. That is the ultimate aim now. Now, okay, define art failure. Write up, take a paper, write down a skeletal notes. I want you guys to write down a skeletal notes. What is that skeletal notes? You should write. So now art failure. In art failure, what I am going to do? For example, I'll tell you. The problem what happens is, I have seen thousands of students making the same mistake. They read textbook thoroughly. They understand the concept. They think they have learned it. And they sit in the exam hall. They see the question. They freeze. They can't answer it. Why? Because understanding is not same as that of the exam readiness. Understanding is passive. Answering exam question is active learning. And you need to know just what examiner will be expecting you in that question. Let me show the difference. So what you guys are doing, art failure, page number 361 to 363. I read every page, every part, every paragraph, not like that. So define art failure. Describe its etiology, pathogenesis, clinical features, and management. This is going to be your question. Don't just answer, read about art failure aimlessly while flipping through your Harrison textbook. Instead, read with a purpose. Read to answer that specific question. Definition. What exactly is your art failure? Etiology, what causes it? Pathophysiology, what's happening inside the heart? Clinical features, how does this patient present to you and how do you treat it? This is called active recall. When you are trying to recall, don't recall the pages. Don't recall the Xerox copy of the pages. Instead, recall what all you studied and read the skeletal structure which you have prepared. And that is why I am sending you a handout. This handout is a skeletal structure. These are the points that the examiner will be expecting you to write in your exam. Clear? You are just rehearsing for your exam. You are answering questions in your mind as you read. Now look at the short notes section on the same day. So in the short notes section on the same day, I have given you what? Infective endocarditis. Infective endocarditis is Duke's criteria. This is going to be your next task. Don't read the entire endocarditis chapter. That's 30 pages. History, epidemiology, pathogenesis, clinical features, and everything. Instead, focus on the mastering the Duke's criteria. Memorize it, understand it, spit it out, and move on. The question bank workbook which I am sending you filters the noise. If the question is there in the textbook, is there in this workbook, it is asked in the past 10 years of exam across various institutions. If a question is not in this workbook, it is low yield, it's noise, ignore it. You can come back to it later once you are confident with the topics I have given you in the workbook. The power of this approach is you are not studying everything, you are studying what matters. Of course, the 20%, 80% of it is from here. 20% it can be asked from anywhere. But if you concentrate on those 20% and if you miss this 80%, you will lose your mark. So let me walk through how your day should actually look like. If you are going to get a study leave from now on, morning, just wake up, read a essay question, open the textbook, read the topic with the question in your mind, write a skeletal notes, heading only, not in paragraph, and tick the boxes. The goal is to go in depth and not speed. You wanted to understand and the concept fully. Then in the afternoon, your energy will be dipping. Your focus is going to be fractured. This is when a typical afternoon slump is going to hit you. This is the time when you need to go for short notes, clinicals, images, instruments, and all those things. Why? Because visual learning is more engaging when you are tired. An ECG or an X-ray or images, anatomical puzzle of cardiac valve problems, all these are going to be very interesting than reading a text. So look at the short note from your question bank. Find the relevant answers in your book, memorize the key fact, tick the box. This will keep you awake and prevent your afternoon crash. Then in the evening, definitely you will be tired. This is the time when you need to focus on the topper's place. I have given you something topper's place, what it is. Once you are confident with the must to know, then you go for topper's place, because must to know is a section that ensures you pass. Topper's place ensures you rank. These are the extra topics, edge case notes, Viva questions that makes the examiner smile. If you are going to answer Austin Flint murmur, if you're going to answer Graham Steele murmur, if you're going to answer Troisier sign, if you're going to answer KF ring in Wilson's disease. If you are tired by 8 p.m., haven't covered the topper's place, no problem. You are still safe because you still can pass the exam because you have covered the must to know topic. But if you have energy, if you are feeling good, read these also. These are the important questions that can separate distinction holders from your normal people. So, how your schedule is going to be? How your schedule is going to be? Remember, your schedule is going to be very simple. Your schedule is going to be first schedule is going to go for the next 30 days, 30 to 35 days. That is from now it is going to be December 22. So, from December 22 to January almost 16th, you will be going for the first round. Then we will go for the phase 2, and from there we will go for phase 3. And remember, I have given you a gap. So from after June, after this, now according to current schedule, till 13th is going to be your day. From 13th to 16th, I have given a gap. Similarly, I have given a gap in the month of March also. So these gaps are going to be buffer days. If you're going to go through the PDF I have sent, these days are going to be a buffer days. If you fall sick, or if you are not able to catch up, or if you are running behind, don't ruin the next day's schedule. You move on. Let the backlog is going to go to the gap days. You can catch up these during your gap days. You can keep up the momentum moving. This is genius because it's realistic. You will get sick, you will have bad days, but don't spiral up your answers, spiral up your topics. Okay, so let me make something more personal to you, how your brain is going to work. Your brain is addicted for closure, as I already told you. It aids the open loop. So when you start something and if you don't finish it, your brain will keep on nag you. It creates a cognitive tension, it creates anxiety and stress. When you complete something, when you tick that box, your brain is going to release dopamine, and this dopamine is a winning hormone. It is the celebration chemical. It's what make you feel good. So this is why workbook is so powerful. Every single day you get dozens of small wins. Art failure done, tick mark, your dopamine is going to hit. MI done, tick mark, your dopamine is going to hit. Infective endocarditis done, tick mark, your dopamine is going to hit. And by the end of day 1, you would have completed 12 dopamine hits. And this is not just good for your mood alone. This is going to be a neuroscience. These dopamine loops is going to build you momentum. They build confidence. They make anxiety impossible. When you sit in the exam hall in February, you won't be hoping for luck. You will be confident. Why? Because you will have ticked every single box that matters. You will have visual evidence for your preparation. And this is exactly called as dominoes effect. So if it is now example, today is going to be December 21, you have a headache, you are just feeling lazy, your best friend is leaving town and you wanted to spend time with them, you are going to miss the today's schedule. So the next day you think, okay, I will do day 6 and day 7 together. You try, you fail, you feel exhausted, you have bitten more than how much you can chew. Now this day 6, day 7 gets accumulated on day 8, then all 3 gets accumulated on day 8, and this is called as spiraling, and this is called as dominoes effect. One missed day becomes 2, 2 becomes 5, 5 becomes 10, 10 becomes a month, and you feel broken at the end, you will lose the momentum, you will lose the confidence, and at the end, you will lose the game. So here is the rule which you are going to follow. If you miss day one is dead. You on day two, you wake up, you do day two. Put day one in the buffer gap. And if you get any chance time on day two, just take one essay from the day one and try to finish it. And after finishing your day two, you don't try catch up, you don't spiral, you protect your mental momentum at any cost. This is most important for every individual. Missing one day is not a failure, losing momentum is going to be a failure. So, how we are going to execute? Let's recap the rule of engagement, the commandments, the non negotiables, which you are going to remember. First, print the schedule which I am going to send you. If you miss one day, don't carry it, move on, protect your momentum, use the gap days to catch up. Then, coming back to the second thing, you need to make it physical, bind it, put it on your wall. I know everyone, they will use a digital version. No one actually follows it because your brain needs to use a physical checkbox. It needs to see the tick mark by your hand. So better take a printout. It needs a tactile feedback. So take a printout and tick it on everyday basis. I am sending you a handouts. That also I will recommend you to print it out and use it and ignore what others are reading. That's what CT Krishnan told you, right? So my junior CT is also in this group who is guiding you excellently, who is sending you, who is motivating you on daily basis. CT has put a message, wonderful message in the group. I have read it. So don't see what others are reading. Let them read in the top institute's notes. Let them read from the standard textbook. Let them read from the guides which they have. It's just remember, you are going to follow your own thing. You're going to follow your own strategy. If it is in this workbook, it is eye yielding. If it is not in this workbook, it is a noise. Trust the system. Don't second guess. Don't start reading random chapters because someone told you this is important, it is important, it is in the workbook. No, don't like do that. If it is important, I would have mentioned in the workbook. Follow that alone. And the 3 daily phases, what you are going to do. First, complete the essays, then short notes, then toppers place. This is your daily architecture. This is what separates the students who struggle from students who dominate. And finally, you are going to tick mark. And at the end of the month, when you count the check boxes, you would have completed everything. Doctors, now you have a roadmap. You have the main workbook. You have a GPS showing you exactly how to reach to your exam. You have a question bank workbook. You have the daily handouts. You have exam questions. You have active recall training ground. You have the toppers place, your competitive edge, your ticket to distinction. You are not paying a single money here. You are going to achieve success without paying even 1 rupee. That is the beauty, yes. That is the beauty of Medusane. What we want from you, your success. And at the end, what we want, that messages that you're going to send after your results, how Medusane has helped you. And you are going to pass on about Medusane to your juniors, and that is the humble dakshina which you are going to provide to us. The next 60 days, you will be feeling very hard. No one is going to sugarcoat that. There will be days when you feel tired. There will be days when you are frustrated. Days when the volume feels overwhelming. And these will also be most productive days in your life when you look back after finishing your exam. When you sit in the exam hall in March, you won't be praying for luck. You won't be hoping that question is easy. You will be confident. Why? Because you have ticked every single box in my workbook and you have covered the 20% that accounts the 80% of your mark. You have gone deep instead of a superficial. You have trained like an athlete and not like a tourist. And here is a challenge to you. Start today. December 22 is your tomorrow. Open your day one. If you are going to start with your medicine, start with your medicine. If you are going to follow the already existing schedule, follow that. Read art failure, understand it completely, tick the box. That's all. Just day one day, one subject, one checkbox. If you do that today, you will do it tomorrow and day after. And by February end, every box will be green. Your success is not my responsibility. Your success is not your college responsibility. Your success is not your faculty's responsibility, but your success is your own responsibility. Your life, your career, your patients are going to depend on you in future. And they are all depending on the decision you are going to make in the next 60 days. So let's get it done. Welcome to Dopamine RRR, Revise, Refine, Reinforce. And I wish you all a very good luck. Again, I repeat, your success is your responsibility. Start today. tick the box and achieve success. So with that, I think my aim is apparently this is the thing. So if you have any doubts, you can put it in the chat box. I will be happy to follow it. I'll be happy to even solve it. I am thinking of new things for you guys. Why I am thinking? Because you are interested. You have joined this group with the trust that you will pass the exam if you join the group, and that trust I have to keep it up. And if I have to keep up that trust, I want you to follow whatever we are telling you every day. Anything or everything, you can just contact CT Krishnan. So he is in the group. He will be a wonderful guide for you all to help you out. Okay, he will be the wonderful guide for you all who will be helping you out. Who will be helping you out. Okay, clear, right? Clear, right? Good. So if you have any further doubts, you can just put it in the chat box. And you can add your friends in the WhatsApp group. I have kept it open only. So you can add all your friends in the WhatsApp group, study together, follow this timetable. And if you have any doubts, again, once again, I reassure you that you can put it in the WhatsApp group, or you can personally message us, and we will definitely be happy to help you guys. Okay. We will be definitely happy to help you guys. So this is something assurance I can give you from my side. So anything else, I'll be very happy to answer. Anything else, I'll be very happy to answer to. So anyone? If not, thank you so much, guys. Let's see you all in next session. Sir, which books are easy to follow and easy to language? Okay, so fine. Before ending, what I wanted to tell you is this is a small thing. This is not advertisement, but so I am a part of this dopamine platform already. So I am taking psychiatry in this platform. So we have curated according to the standard textbook CBME curriculum, but I think so this is too late for you to even to you buy a platform or anything. So I don't I want you guys to go through. If you want any trial, you can just contact this number in the chat in the screen. So if you want, you can get a trial of the app, so that at least you can use it as a trial basis, and if it is helping you, you can just suggest to juniors. And second thing, books. So I will answer this books part now. So for medicine, I think most of you will be using Davidson, but for exam purpose, either you will go for Archit Balur, which is in the question answer format. So Archit Balur is a question answer format, or you can actually go for Mandapa. So these two are, I think so, which is the most commonly asked. Manipal, that is, I have Manipal for Mandapa exactly. So Mandapa you can go through. This is second thing which you can. For surgery, mostly I will recommend, if you are following SRB manual, follow that itself, or you can go for Manipal surgery book. So that is what I usually will be recommending. For pediatrics, mostly don't go for any guide or anything. Better to use your Guy, because Guy is already a easier version. So I don't think so you need to change your book right now. And OG, there are various books available, but better books, if you ask me, for OBG is you can follow Datta, or you can follow Mudaliar Menon. Mudaliar Menon is most commonly used. Or you can go for gynecology, you can go for Shaw. So coming back to the practicals. So practicals, mostly we will be going for Gundu book, Arup Gundu sir book for your medicine. Or now Archit sir's book also is very good. So you can follow either of them. Surgery, of course, you have this yes, Rajamahendran sir, RRM sir's book. So that is like a must book, I will tell. RRM long case and short case book. I think everyone must have it. Apart from that, if you follow any other, Manipal also now came up with some clinical methods, so you can follow that also. And then for pediatrics, you pediatrics la we have various practical books, right? Lakshmana Swami, Arachami sir book. So that you can follow. Arachami sir's book you can follow. And apart from that, now various Sandeep sir book also have came. So, but I standard I have used Arachami book only. And OBG, of course, you have three teacher book, green color book, which you will be having Premalada ma'am, written by Premalada ma'am. So that you can follow. And apart from that, even that Lakshmi ma'am's book. So from your, I think it is available in your Walter Clover's one book is available. So I think that you can follow. So that's all. And but one thing what I want to tell you is you have just 60 days. Okay, don't change your reference. Don't change. Okay, don't change your reference material. Don't change your reference material. This is something I wanted you all to remember. Don't change your reference material. Okay, don't change your reference material, guys. So that is a very, very important thing I want to tell you. So don't change your reference material. So apart from that, if you have any doubt, you can just ask me. Okay, can just ask me. So what I will do is, so first I have given you a timetable, a fixed timetable. Second thing, I am giving you handout. Okay, and third thing is I want you guys to follow our Instagram, where I will be posting Instagram page la. I will try to post on everyday basis some flashcards. So those flashcards mainly I want you to see before your exam, before your sleep. Okay, a day before your exam and before your sleep, you can just go through it. So Insta ID is Medusane. Okay, you can go, you can just install it, you can just follow, and you can just utilize it. And fourth one, in our YouTube channel, we already have all the pediatric cases, all pedia cases we already have. Okay, so and then all the surgery cases we already have. That too from examiners, real time examiners. We have all the surgery cases. We have many medicine lectures by Dr. Reshmi ma'am. So you can just go through those lectures also. And in between, if I have time, I will take neuro myself. Okay, I will take neurology classes in between. If I get time, I will just do it like a 1 day session pola. Some Sunday, in the upcoming Sundays, I will try to do a one neurology session for you guys. And apart from that, what I will be doing is I am sending you handout on everyday basis. Apart from that, I am trying to prepare question bank with answers like question paper wise for discussion, but I am not sure I will be able to complete it by the time of before your exam. But whatever I am completing, I will be sharing with you guys, so that it will be helpful for you before your exam. And sixth one, what I will be doing is every let's take Wednesday and Saturday. So every Wednesday and Friday. So let's have like this. Every Wednesday and Friday, we will have a review session in the Zoom, review in the Zoom. So where you can ask your doubts. And apart from that, I am also arranging faculties for doubt clearance, as well as for doubt clearance, as well as or orientation on that subject. What are the important questions? Likewise, we will try to do a session orientation subject wise. I will be trying to do. Okay, these things are my promise. So what is your promise? What is your promise? Can you put in the chat box? What is going to be your promise to me? What is going to be your promise to me? Can you put in the chat box? I'll share the YouTube channel link with you guys. Don't worry. So what is your promise? Can you put it in the chat box? What is your promise? Your promise is going to be following the schedule. Okay. Read properly without wasting your time. You're going to read without wasting your time and achieve not less than distinction. Okay, not less than distinction. Anyone in this group, you should not achieve less than distinction. Okay, so work, stay consistent, work hard, complete the target. Exactly, that's what you're going to do. Okay, fine. So with that, I am just completing the today's session. Wish you all the best.